Have you ever wondered, what if the very pill you swallow every morning to protect your heart could one day be the reason it suddenly stops Daniel Thompson, 68 years old, lived a quiet life in Arizona? He followed instructions carefully. He never missed a dose. Every morning with his coffee, he took the medications prescribed by his cardiologist. He believed he was doing everything right. He believed he was protecting his future. Dr. Javier Morales later shared Daniel's story as a warning, not as an accusation, but as a reflection of something happening across America. Daniel was not reckless. He was responsible. He trusted the system. Yet what happened to him reveals a reality that many older adults are never fully told. After the age of 60, the body does not process medications the same way it did at 40. Liver function slows. Kidney filtration declines. Drug clearance becomes less efficient. When multiple prescriptions are combined, even if each one is appropriate on its own, the cumulative effect can quietly overwhelm the cardiovascular system. In the United States, nearly 40% of adults over 65 take 5 or more prescription medications daily. This condition, known as polypharmacy, increases the risk of dangerous drug interactions, metabolic strain, and unexpected cardiac events. Often no single pill is the sole culprit. It is the combination, the accumulation, the years of unquestioned continuation. Daniel experienced subtle warning signs: fatigue that seemed like normal aging, occasional dizziness, a sense that his energy was fading. Nothing dramatic, nothing urgent, until one morning shortly after taking his usual medications, his heart rhythm became unstable. This video is not about fear, it is about awareness. Today we are going to examine 7 commonly used medications that may require careful reevaluation in adults over 60. Not because medicine is evil, but because aging changes the rules. And understanding those changes could protect your life. The first category that deserves careful attention is statins, one of the most commonly prescribed medications for adults over 60. These drugs are designed to lower cholesterol by blocking an enzyme in the liver responsible for its production. For many patients, they can reduce cardiovascular risk when used appropriately. However, long-term use in older adults requires ongoing evaluation. Statins also reduce the production of coenzyme Q10, a compound essential for energy generation in heart muscle cells. As people age, natural levels of coenzyme Q10 already decline. When this compound drops further, some individuals experience muscle weakness, fatigue, and reduced exercise tolerance. These symptoms are often dismissed as normal aging, yet they may reflect reduced cellular energy within the heart itself. Research has also shown that statins may increase the risk of developing type 2 diabetes in certain populations, particularly in older adults with metabolic vulnerability. When diabetes develops, additional medications are often added, increasing overall drug burden. The issue is not that statins are universally harmful, but that their necessity, dosage, and long-term continuation should be periodically reassessed, especially when symptoms appear. The second category is non-steroidal anti-inflammatory drugs commonly used for arthritis, back pain, and everyday discomfort. Medications such as ibuprofen and naproxen are widely available without prescription, which often creates the perception that they are harmless. In reality, these drugs can affect kidney function and fluid balance, particularly in individuals over 60. NSAIDs reduce prostaglandins, compounds that help maintain blood flow to the kidneys and regulate blood pressure. In older adults, this reduction can contribute to fluid retention, elevated blood pressure, and increased cardiovascular strain. When combined with blood pressure medications, diuretics, or blood thinners, the risks may multiply. Even short-term use has been associated with an increased risk of heart attack in vulnerable individuals. Additionally, NSAIDs can increase the likelihood of gastrointestinal bleeding, especially when taken alongside anticoagulants. The danger often lies not in one pill, but in the combination of several. What appears to be routine symptom relief can, over time, become part of a larger physiological burden. Careful review dose awareness and open discussion with a healthcare provider are critical steps in reducing that risk. The third category, often overlooked in cardiovascular discussions, is proton pump inhibitors, commonly known as PPIs. These medications are widely prescribed for acid reflux and stomach protection, especially in older adults who take multiple prescriptions. Drugs such as omeprazole and pantoprazole are frequently continued for years without reassessment. PPIs work by suppressing stomach acid production. While this can relieve reflux symptoms, stomach acid also plays a crucial role in absorbing essential nutrients such as magnesium, vitamin B, 12 calcium, and iron. Over time, reduced absorption may lead to clinically significant deficiencies. Magnesium is particularly important for heart rhythm stability. Low magnesium levels can contribute to irregular heartbeats, muscle weakness, and increased cardiovascular risk. In older adults who may already have marginal nutrient levels, long-term PIUs can quietly compound the problem. Vitamin B12 deficiency may also contribute to fatigue, cognitive decline, and elevated homocysteine levels, a marker associated with vascular damage. Again, the issue is not that PPIs are inappropriate in all cases. They are highly effective when used for clearly defined conditions over appropriate durations. The concern arises when they are continued indefinitely without evaluating whether they are still necessary. The fourth category is beta blockers, medications commonly prescribed for high blood pressure, arrhythmias, and heart disease. These drugs function by blocking beta adrenergic receptors, reducing heart rate and decreasing the force of contraction. For certain cardiac conditions, they can be life-saving. However, in older adults, careful dose monitoring is essential. Excessive slowing of the heart rate can result in fatigue, dizziness, and in severe cases, dangerously low heart rhythms. Because aging hearts may already respond less efficiently to stress, excessive suppression can reduce exercise tolerance and overall vitality. Beta blockers have also been associated in some individuals with mood changes, depressive symptoms, and metabolic effects such as reduced insulin sensitivity. While not everyone experiences these effects, they may be more pronounced in older patients with multiple comorbidities. Abrupt discontinuation of beta blockers is never recommended as it can lead to rebound increases in heart rate and blood pressure. Instead, regular evaluation with a healthcare provider ensures that the medication remains necessary, appropriately dosed, and balanced within the broader treatment plan. As we move forward, you may begin to notice a pattern. The question is rarely whether a medication works. The real question is whether it is still appropriate at the current dose in the current stage of life. The fifth category that deserves close attention is diuretics often prescribed for high blood pressure, heart failure, or fluid retention. These medications help the body eliminate excess salt and water through urine. In many cases, they provide meaningful relief and reduce cardiovascular strain. However, in adults over 60, the balance becomes more delicate. Diuretics can lower important electrolytes such as potassium and magnesium. Both minerals are essential for maintaining a stable heart rhythm. When levels drop too low, the risk of arrhythmias increases. Symptoms may begin subtly with muscle cramps, weakness, fatigue, or lightheadedness. In more severe cases, significant electrolyte imbalance can trigger dangerous rhythm disturbances. Older adults are particularly vulnerable because kidney function naturally declines with age. Even mild dehydration can reduce blood volume, lower blood pressure excessively, and increase the risk of dizziness or falls. A fall in someone taking multiple medications can quickly become a serious medical event. When diuretics are combined with other cardiovascular drugs, the cumulative effect on blood pressure and kidney workload must be monitored carefully. The sixth category is anticoagulants, often referred to as blood thinners. These medications are prescribed to prevent strokes, especially in people with atrial fibrillation or prior clotting events. Drugs such as warfarin, rivaroxaban, and apixaban have saved many lives by reducing the risk of dangerous clots. At the same time, they require careful balance. Anticoagulants work by interfering with the body's clotting mechanisms. While this helps prevent unwanted clots, it also increases the risk of bleeding. In older adults, blood vessels may be more fragile, and the consequences of a fall can be more severe. Even minor trauma can sometimes result in internal bleeding. Gastrointestinal bleeding is another important consideration, particularly when anticoagulants are combined with NSAIDs or aspirin. Because symptoms may develop gradually, fatigue or weakness may be mistaken for normal aging rather than early blood loss. This does not mean anticoagulants should be avoided when clearly indicated. It means that risk and benefit must be revisited regularly. Kidney function fall risk and drug interactions all influence whether the current treatment plan remains appropriate. As we continue, one final category may surprise you because it is rarely discussed in connection with heart health. The seventh category is one that rarely enters conversations about heart health, yet it quietly affects millions of older adults every night. Sleep medications, including sedative hypnotics and certain anti-anxiety drugs, are commonly prescribed for insomnia. As sleep patterns change with age, many adults over 60 turn to these medications for relief. While improved sleep can enhance overall well-being, some sleep medications depress the central nervous system. This means they slow brain activity, reduce respiratory drive, and can lower blood pressure. In older adults, this suppression may increase the risk of nighttime falls, confusion, and impaired coordination. When combined with cardiovascular medications that already influence heart rate or blood pressure, the cumulative effect may become significant. Some sedatives can also interfere with normal breathing during sleep, particularly in individuals with undiagnosed sleep apnea. Reduced oxygen levels overnight place additional strain on the heart. Over time, this strain may contribute to irregular heart rhythms or worsening cardiovascular health. Another concern is cognitive impact. Long-term use of certain sleep medications has been associated with memory difficulties and daytime drowsiness. These changes may not happen suddenly. Instead, they develop gradually, making it difficult to distinguish medication effects from natural aging. It is important to emphasize that sleep itself is essential for heart health. The solution is not to ignore insomnia. Rather, it is to explore whether the current approach remains the safest one. Behavioral sleep strategies, improved sleep hygiene treatment of underlying anxiety, and evaluation for sleep apnea may reduce the need for long-term sedative use. By now, a clear pattern has emerged. The greatest risk is rarely a single prescription taken for a short time under careful supervision. The risk increases when medications are continued for years without reevaluation, layered on top of one another, each one appropriate in isolation but overwhelming in combination. This is not a message of fear. It is a message of empowerment. Aging changes physiology. Treatment plans must evolve accordingly. The goal is not to eliminate necessary medications, but to ensure that every pill still serves a clear purpose today. And that brings us to the most important part of this conversation. Before we close, I want to share something personal. After years of working with older patients, I have come to believe that the greatest threat to healthy aging is not disease alone. It is passive healthcare. It is the quiet assumption that once a medication is prescribed, it should continue indefinitely without question. Medicine evolves, bodies change, risk profiles shift, yet prescriptions often remain on autopilot. Daniel Thompson's story, which was shared by Dr. Javier Morales, is not presented to create fear or to assign blame. It is not meant to suggest that any single medication directly caused his death. In complex medical cases, outcomes are rarely the result of one factor alone. His story represents a pattern that many physicians observe in aging populations, the cumulative effect of multiple medications over time layered onto a body that is no longer metabolizing substances the way it once did. This video is for educational purposes only. It is not medical advice. It is not a recommendation to stop, change, or refuse any prescribed treatment. Abruptly discontinuing medications, especially cardiovascular drugs, can be dangerous and even life-threatening. Any changes to your treatment plan must be made under the supervision of a qualified healthcare professional who understands your individual medical history. My professional opinion is simple. Medications are powerful tools. They can save lives when used correctly at the right dose for the right duration, but they should never be continued by default without reassessment, especially after the age of 60. If you are taking multiple prescriptions, schedule a dedicated medication review, not a rushed visit, a focused conversation. Bring a full list of everything you take, including over-the-counter products and supplements. Ask clear questions. Do I still need this? Is this dose still appropriate? Are there interactions we should reassess? Is there a long-term plan? A good physician will welcome those questions. The goal is not to reject modern medicine. The goal is to use it wisely, to combine scientific advances with personal responsibility, to balance treatment with regular reevaluation. If this discussion helped you think differently about your health, share it with someone you care about. Many older adults assume that more prescriptions equal better protection. Sometimes the most powerful protection is simply a thoughtful review. Subscribe if you want more balanced conversations about heart health, aging, and responsible medication use. Leave a comment sharing one question you plan to ask at your next appointment. Your health deserves attention, it deserves understanding, and most importantly, it deserves your active participation.